Welcome to today's lecture on non-communicable diseases. I'm Abraham Piri from Nanga District. I'm presenting a topic on non-communicable diseases. What are non-communicable diseases? These are diseases which are not transmitted from one person to another, meaning that there is no connection of this disease to be transmitted from one person to another. What are some of the examples of these non-communicable diseases? For example, you might ask to know. One of the examples is we have diabetes mellitus. Diabetes mellitus is a condition whereby there are low levels of insulin in the blood, such that they are unable to control the sugar levels, whereby it leads to increase in sugar levels in the blood. Where with the pancreas in the body, this pancreas is the one which produces insulin. So now if there is inadequate production of insulin, what will happen is that when somebody eats, the sugar in the blood won't be converted to enter the tissues. As a result, it will just remain as high in the blood. That's what we call high blood sugar in the blood. Then also, we have got hypertension. Hypertension is a condition whereby there is high pressure which is being exerted in the blood vessels. As a result, the pressure becomes high. This is the one which people usually call BP in layman's language. Then also we have got asthma. Asthma also whereby when somebody has got difficulties in breathing, there is narrowing of the lungs. As a result, somebody has got difficulties in breathing. This condition is not transmitted from one person to another. There is also bronchitis. We also have the cancers. We also have epilepsy, where somebody can convulse. We also have pneumoconiosis, which is a work-related condition. We also have sickle cell anemia. We have got also psychosis, a psychiatric condition. We also have ulcers. Ulcers are non-communicable. Then also, how do these non-communicable diseases come about? One of them can be a lifestyle that we lead. For example, when I talk of hypertension, it's a situation whereby the eating habits that we have, whereby the diet contains a lot of fats. The fats, you discover that these fats, when they are too much in the body, they will be in the blood vessels. In the blood vessels, they are going to cause what we call narrowing of the blood vessels, which is going to lead to high blood pressure. And in due course, when there is consistent high blood pressure, at one time somebody might develop a condition called stroke, because the blood supply, the vessels which are supposed to supply blood to the brain are very narrow. They are like the capillaries. As a result, they are going to rupture. When they break, blood is going to create a certain clot in the brain. As a result, somebody is likely to have what we call stroke. Then also, we have got conditions like lung cancer. Lung cancer sometimes comes as a result of smoking cigarette. And when somebody is smoking cigarette, they say one stick of a cigarette is equivalent to 11 minutes of reduction in the lifespan. So what do they mean? They mean that somebody is likely to have lung cancer. And lung cancer, there is no treatment for it. As a result, somebody is likely to lose his life. So that condition is not transmitted from one person to another. Then there is also psychosis. When you're talking about psychosis, it's a psychiatric condition whereby sometimes it can be inherited through the family. Then at the same time, somebody is having a lot of stress, a lot of thinking a lot, but last in the end up developing the condition called the psychosis. Then there is also another condition which is inherited, that is sickle cell anemia. Sickle cell anemia is an inherited condition whereby there is clogging of the blood vessels, there is a destruction of the red blood cells. As a result, somebody ends up having sickle cell anemia. Then there is also what we call the ulcers. The ulcers, these are the sores which are formed in the stomach of the human body. These sometimes they say they are also inherited in the family. Sometimes they even say that no, those people with the blood group O, they are likely to have ulcers. So ulcers are not even transmitted from one person to another. They just come the way they are. Then also, lack of exercises. If somebody is not exercising, what will happen is that you will start getting fat. When you start getting fat, the blood vessels are going to be narrowed, whereby pressure is going to increase. Somebody is ready to have high blood pressure. Also, at the same time, because of that overweight, somebody can also develop diabetes mellitus. Then also, how do these communicable diseases prevented? How they can be prevented?
Okay.
Okay, like in terms of preventing hypertension and diabetes mellitus, one can do well to do a lot of exercises. When you do a lot of exercises, at least you're trying to remove what has entered in the body. Because there is no way you can just be eating, then at the same time there's nothing which is coming out. Meaning that it should be a two-way thing. There is what we call garbage in, garbage out. So what enters the body should also equal to what comes out of the body. By so doing, you're going to balance the situation.